Yes, this kitchen's beautiful here at the Ronald McDonald Room here at the hospital. It's an amazing place. But we have Dr. Mary Murray here, and specifically to talk about diabetes. And people don't really think about it with children, but who's at risk?
Any child is at risk. Children with obesity and a strong family history of type 2 diabetes are at increased risk for type 2 diabetes, but any child can be at risk for type 1 diabetes.
So what are the early symptoms? I mean, if you don't have it in your family, anything like that, when do kids start showing some symptoms?
Kids can show symptoms at any age. The symptoms that parents should be watching for are polyuria, polydipsia, and nocturia, and unexplained weight loss.
What are those things? In English, what's that?
Going to the bathroom a lot, so driving to the mall and the kid has to stop at every single bathroom. Drinking a lot, disproportionate to what other siblings are drinking. A child who's not wet the bed in years, all of a sudden starting to wet the bed, I think is a big red flag. And then a child who's eating and drinking a lot but still seems to be losing weight. Those are the classic symptoms of diabetes, either type 1 or type 2.
Okay, and we're in the kitchen because food does affect diabetics, right?
Food is more of a player and diet is more of a player in type 2 diabetes because type 2 diabetes is related to obesity. Type 1 diabetes is not related to obesity. It happens to thin kids, heavy kids, doesn't make any difference. But once you have type 1 diabetes, you have to pay a lot of attention to how you eat, what you eat, and balance your food and your insulin.
And if you ever have a question about your child's health, ask your doctor. Make a phone call.
Make a phone call and ask, and don't be afraid to go in and find out if you see symptoms, what's going on.
Because the earlier it's caught, the better it is to treat.
The earlier it's caught, the safer it is for your child, yes.
Right. Early detection is the key. And if you have any questions about your child's health, any children's health, you can call the number today. We have experts like Dr. Murray. They'll be taking phone calls and answering questions or referring you to the people who do have the answers. So don't worry about it. You're getting good information. And the number, it's the 800 number, 762-7262. It's a little different number than before. So we have the panel up here today at Primary Children's Hospital. So they are taking your phone calls, or you can tweet a question. It's #AskTheExpert. And they'll answer your question on Twitter, too. Guys, back to you.
Lots of ways to get a hold of that.
Yeah, and we've had a lot of great information, and it's been fun to see the setup there at Primary Children's Hospital. A lot of people maybe didn't realize.
A lot of it's new and just beautiful.
It is beautiful.
Looks great. Mary, thanks for showing that to us, too.